If you think you need to be an expert on injuries before you can work with students who have pain, this video is going to challenge that belief. I'm Monica, and I want to talk about what expertise actually means and why you don't need the kind of expertise you think you need. This might be uncomfortable to hear if you've been using the excuse, I'm not an expert, as a reason to not help students with pain and injuries, but I think it's an important conversation for us to have. Now, let's start with a question. What does it mean to be an expert? Most yoga teachers think being an expert means knowing everything about anatomy, pathology, biomechanics, and rehabilitation, having advanced degrees, being able to diagnose conditions, having answers to every question a student might ask. But here's what I've realized after years of working with students who have pain. That's not the kind of expertise that matters most in a yoga class. Students with pain don't need you to diagnose their condition. They usually already have a diagnosis from a doctor or a physical therapist. They don't need you to create a rehabilitation plan. That's their PT's job. They don't need you to know every detail about their specific pathology. They need you to create an environment where they feel safe to explore movement. What they actually need is a teacher who understands that pain is a protective output from the brain. A teacher who can use language that reduces threat instead of increases it. A teacher who offers options without making them feel less than. A teacher who creates a sense of safety and community. And a teacher that helps them build confidence through gradual exploration of movement. You see, that's a different kind of expertise, and it's something you can develop without having to go to graduate school or get a doctorate in physical therapy. There's clinical expertise, what doctors and PTs have. They're trained in assessment, diagnosis, and treatment. They understand pathology and rehabilitation protocols. And then there's teaching expertise, what you have as a yoga teacher. You're trained in creating group learning environments, sequencing practices, using language effectively, and facilitating exploration in movement. Both kinds of expertise are valuable. So you're not trying to develop clinical expertise. You're trying to develop teaching expertise that's informed by modern pain science. That means understanding how pain works as a protective mechanism, how to create psychological safety in your classes, how the language you use either reduces or increases threat, how to offer options that invite exploration, and how to respond when a student experiences pain. You can learn all of that. And once you understand those principles, you can work with students who have pain. Here's another thing, and something that might surprise you. Some of my best teaching moments have been when I said to a student, I don't know. A student asked me a specific question about their condition, and instead of pretending I know or deflecting, I say, that's a great question, and I honestly don't know. So let me do some research and we can explore this together if that sounds okay for you. Or a student tries a modification I suggest and it doesn't feel right. And instead of having all the answers, I say, okay, let's try something different. What do you think would feel better for you? That vulnerability, that honesty, that willingness to be a co learner rather than an all knowing expert. Students respect that. It creates trust, it creates partnership. So you don't need to know everything. You need to be comfortable with uncertainty and you need to be willing to say, I don't know. Let's figure this out together. Actually, teachers who think they know everything kind of scare me more than teachers who are comfortable with uncertainty. The teachers who scare me are the ones who make promises about outcomes, who prescribe specific movements as solutions, who act like they can fix students. Those teachers are operating from the old model of understanding pain and recovery practices. The teachers I trust are the ones who understand the limits of what they can offer, who are humble about what they don't know, and who prioritize creating safety over demonstrating expertise. This is the key mindset shift that I want you to take away from this. You're not a fixer, right? You're a facilitator of movement. A fixer says, I know what's wrong with you and I know how to fix it. Do these specific things and your pain is going to go away. But a facilitator of movement says, let's create an environment where you can explore movement safely. Let's try some options and see what feels okay for you. Let's work on building your confidence gradually. Fixers need to be experts. Facilitators need to just be present, curious, and skilled at creating safety. You can be a facilitator without being a clinical expert. So, what does this look like practically in your teaching? It means when a student tells you they have back pain, you don't need to know the specific details of their disc bulge or muscle strain. You need to understand that it might just be their nervous system that's being protective, and then you create an environment where they can explore movement without being fearful of it. It means when you offer modifications, you're not prescribing a correct version to fix their problem. You're offering options for exploration so that they can discover what feels manageable for them on that particular day. It means when someone asks you a question you don't know the answer to, you're comfortable saying, I don't know, instead of pretending like you do. It means you measure your success not by whether you eliminated someone's pain, but by whether you help them build confidence, reduce fear, and discover that movement can be safe. That's teaching expertise, and it's incredibly valuable, and it's something you can develop. This is what I want you to hear. You have enough knowledge to start. You don't need another certification. You don't need to know everything about everything. You need to understand modern pain science, learn to create safe environments, and be willing to be a guide and an observer. And most of all, a good listener rather than a fixer. And the only way to develop that expertise is through practice, not through more courses or more books, through actually working with students, navigating real situations, learning what works and what doesn't. But you can't practice if you keep saying, I'm not an expert yet. At some point, you have to trust that you have enough to start. If this is shifting how you think about expertise in your role, I published a podcast episode on this. It's episode number 115, Mindset, Imposter Syndrome, and Your Scope of Practice on the Essential Conversations for Yoga Teachers podcast. And it goes much deeper into the mindset shifts that will help transform how you teach. I'll link it in the description. I also offer a workshop within your scope that helps you get crystal clear on what expertise you actually need versus what you think you need. It defines your role exactly and helps you step into your value. The link is below. And if you know you're ready for a deep transformation, 6 months of learning modern pain science, building confidence, and practicing these skills with real students, check out my Teaching Students with Injuries mentorship. It's also linked in the description. But most importantly, subscribe for more evidence-based teaching strategies. And remember, you don't need to be an expert, you need to be a guide, and you already have the start of what it takes.